Okay, Bismillahirrahmanirrahim. A very good evening to all respected scholars, esteemed patrons, advisory members, colleagues, and distinguished participants for joining us from different parts of the world, Alhamdulillah, today. On behalf of Huma Civilizational Dialogue and Harmony Foundation, it's my great pleasure to welcome you all in this online lecture series titled Civilizational Dialogue and the Advancement of Medicinal Knowledge and Practices. Huma Civilizational Dialogue and Harmony Foundation is committed to fostering meaningful dialogue, intellectual exchange, and peaceful coexistence across civilizations, cultures, and faith traditions. In today's program, that reflects this ongoing commitment to engaging in history of medicinal knowledge and practices through a civilizational perspective. In Huma Civilizational Dialogue, it's not just merely an interfaith dialogue or interreligious dialogue. Rather, it embraces different branches of knowledge to ensure the epistemic integrity and have civilizational dialogue in different both philosophical, technological, and ethical and religious domains of involving the different civilizations from different parts of the world. So in this program, we are honored to have an esteemed panel of scholars, intellectuals, our distinguished speaker, Professor Dr. Mushtaq Ahmad Siddiqi, the chair of the session, Dr. Haizan Muhammad Yusuf, our president, the organizer of the event, Professor Hamidullah Marazi, who is the president of Huma Civilizational Dialogue and Harmony Foundation, and our esteemed advisory members, whose presence greatly enriches this program. So this session will be presided over by Dr. Haizan Muhammad, a prominent consultant and surgeon of orthopedic and managing director of OSA Technologies, Southern Mahad from Malaysia. With his kind permission, we shall proceed with today's program as scheduled. But before proceeding further, first I would like to briefly introduce our today's esteemed panelists, Professor Mushtaq Ahmad Siddiqi Sahab, Dr. Haizan Muhammad Yusuf, and our president, Professor Hamidullah Marazi. I will start with our keynote speaker, Professor Dr. Mushtaq Ahmad Siddiqi, an eminent professor and medical scientist who served as Vice-Chancellor of the Islamic University of Science and Technology from year 2016 to 2021. He previously had several positions at the Kashmir Islamic Institute of Medical Sciences, including professor from 1998 to 2012, center coordinator of the Advanced Research for Genetic Diseases from 2004 to 2012, chairman and head of the Department of Immunology and Molecular Medicine from 2003 to 2012, and head of the Department of Central Laboratory Medicine and Clinical Biochemistry from 1990 to 2003. He has also served as a visiting scientist and professor at universities in Japan and Germany, and was awarded a postdoctoral fellowship by the Ministry of Science, Art, and Culture, Government of Japan in Tokyo from 1981 to 1983, and he has contributed extensively to research with more than 100 international and 20 national research works. So we have with us the chair of the session, Dr. Haizan Muhammad, who is a distinguished orthopedic surgeon, medical technological entrepreneur, and humanitarian leader. He currently serves as managing director of OSA Technology, Southern Bahad, and the consultant orthopedic surgeon at Sunway Medical Center, Malaysia, and the Vice-Chancellor of the Medical Technology Industry Group under the Federation of Malaysian Manufacturers. So with his expertise in orthopedics, trauma, and sports injuries, Dr. Haizan combines clinical excellence with innovation in medical technology and healthcare development. Dr. Hazen has also received multiple national and international recognitions, including AAOS Scholarship Award, Most Outstanding Malaysian of the Year, and the Outstanding Young Malaysian Award. Beyond his professional achievements, he is widely respected for his humanitarian and relief efforts across Asia and the Middle East, contributing medical expertise to communities affected by disasters and conflict. And we have our president, Professor Dr. Hamidullah Marazi, also known as Hamid Nasim Rafi Abadi, as a scholar of Islamic philosophy, religious studies, and civilization thought. With 3 decades of academic and research experience, his work focuses on Islamic philosophy, knowledge integration, Islamic research methodology, and interreligious dialogue, along postgraduate supervision and the global collaboration. He has served as Dean of Social Sciences and Media Studies at Central University of Kashmir, Head of Religious Studies, and Director of International Center for Spiritual Studies. He is a visiting professor of Alia University, Kolkata, and was distinguished visiting researcher at ISTIC IIUM Malaysia, a prolific author of 65 books on Islamic philosophy, epistemology, and science religion discourse. Professor Marazi has produced dozens of impactful research works. He serves as a president of Homa Civilization Dialogue and Harmony Foundation, advancing dialogue and peaceful coexistence across cultures. So I would like to request all the participants, if anyone is having microphones muted on, so please keep muted. And participants are welcome to post their questions in the chat box, which will be taken up during the Q&A segment. Now, with the permission of our chair, Dr. Hazen Mohammed Yusuf, it is now my honor to invite our president, Professor Hamidullah Marazi, to deliver the welcoming address before, inshallah, going to the main segment of the program. So may I now respectfully invite Professor Dr. Marazi, sir, to deliver the welcoming address. You're welcome.
Thank you, Dr. Farid. Although you have already introduced our great panelists, mashallah, we are so much honored by their presence, by their encouragement. I will take a few minutes about, civilizational dialogue in the context of medicine, and then we'll be listening from Professor Mushtaq, Siddiqi Sahab, and then also Professor Hazen. Ancient Greek medicine, especially the works of Hippocrates and Galen, formed the foundation of medical education for many centuries. Alexandria in Egypt became a major center for medical learning, where Greek medical texts were collected, preserved, studied, and taught. Egypt's favorable climate helped preserve ancient medicinal manuscripts, including important papyri discussing the causes of diseases and early medical theories. Christian scholars studied and translated Greek medical works into Syriac. Among their most important was Sergius of Rashaina, who translated numerous medical writings of Galen. Under the Abbasid Caliphate, Baghdad emerged as the leading center of medical scholarship. Scholars translated Greek medical texts from Greek and Syriac into Arabic. The most influential translator was Hunayn ibn Isaac, whose translations of the Galen's medical works became standard references throughout the Islamic world. Muslim physicians and scholars preserved, studied, and explained Greek medical knowledge, making Arabic the principal language of medical science for several centuries. Later, Arabic medical texts were translated into Latin, particularly in Toledo, allowing Greek and Islamic medical knowledge to enter medieval European universities. Following the fall of Constantinople, Greek manuscripts reached Western Europe, further enriching medical scholarship. Renaissance printed such as Aldous Manutius published Greek medical texts, making them widely accessible and helping lay the foundation of modern medical education. Greek medicine thus survived because it was continuously preserved, translated, and transmitted by Christians, Muslims, Jews, and European scholars. Through Syriac, Arabic, and Latin translations, the medical teachings of Hippocrates and Galen became a shared intellectual heritage that shaped medicine in both the Islamic world and Europe. And Muslims added a great deal of knowledge to medical corpus of different studies. And in this way, this subject became a great source of civilizational dialogue, and it has been shaping new avenues with every passing day. With these words, I feel that we can just think on those terms, how the dialogue has been continuing and how much it has been affecting our new generations. Thank you very much. Jazakallah khair.
Thank you so much, Professor Hamidullah Razi, for those insightful opening remarks. We may now proceed to our keynote speaker. That's the central segment of this today's program. So may I now invite Professor Mushtaq Siddiqi to deliver the keynote lecture on civilizational dialogue and advancement of medicinal knowledge and practices. Professor, you are welcome.
Yeah, good evening to everyone. I mean, every participant here, and also to Dr. Haizan, who is the chair of this session. Thank you for chairing my session, and thank you, Dr. Farid, for giving my introduction to the participants. Primarily, I have been an immunologist, a trained immunologist, and I worked mostly in the areas of HIV, where AIDS came actually into the existence of literature when I was myself a postdoc at Tokyo Medical School, Japan, where I ultimately, it was in the very preliminary stages that time the HIV was being discovered. It was not even HIV that time. It was still, Dr. Haizan might be knowing, it was HTLV3 and LAV. We would call it as human T lymphotropic virus or lymphadenopathy associated virus. So I became associated with HIV disease all through 1983 till my retirement from the job of the professor at the medical institution where I worked for 28 years. I developed during the period, I developed a gene therapy model for treating the HIV positive people, because most of the times HIV people, they would die because of opportunistic infections. I tried to restore their immune system. So this is my background, but given the topic that was given to me, it's a kind of I would definitely say that I collated the data. It's not my principal data, which I have done by myself, any work in this area. So it's a collation by different. I used different AI tools. I used DeepSeek. I used the Grok. I used the GPT-4. So I actually tried to bring in most of the literature, what is present in different civilizations and how medicine evolved during the different civilizations. But it would take me, when I made the presentation, it actually was comprising of around 200 slides on a PPT. So I brought it down to hardly 35. Now you can imagine how much I had to squeeze it to, because it's a huge subject. It's actually civilizational impact on different aspects of medical knowledge is a huge subject. So I'm sure most of you must be knowing what I'm going to talk. So it's a just collation of all the data that was present, and I tried to do a little bit of justice with what is present in the literature. So next, please, Dr. Farid. I'll go through the next. You can go. You can say the development of medicine and civilizational growths are deeply intertwined, as societal progress and the ability to heal have evolved in tandem. A healthy population allowed societies to develop complex infrastructures, which ultimately led to the development of the civilizations, while medical discoveries directly enabled the populations to thrive. It was very important that the populations should thrive. So civilizations would not be in the existence if they would not thrive. I mean, if humans would not thrive. So the next, please. So if you look at the question is whether civilizations helped to develop knowledge of medicine or knowledge of medicine helped in stabilizing civilization. And my opinion on this, working in science and deep hardcore science at the molecular level, my answer is, next please. My answer is this one. The medicine and civilizations are complementary to each other and they are inseparable. They're in a way conjoined twins. So if medicine would have not been there, civilizations would have not thrived. If civilizations were not there, we would have not gained the knowledge of medicine. So next, please. The intersection of medicine and civilizational development is extensively documented in historical and academic literature, tracing how healthcare systems have shaped and reflected human progress. Next, please. The history of medicine is a testament to humanity's pursuit of knowledge and healing. From ancient civilizations to modern clinical practice, medical science has evolved through innovation, cultural exchange, and scientific discovery. Recognizing the historical roots of medicine enhances our appreciation of modern healthcare and encourages a more ethical and humanistic approach to patient care. Continued study of medical history remains essential to shape the future of medicine. It's very important. You know, why should we look at the history? Histories are important because we want to see how many epidemics were there and how epidemics were, taken care of by that civilization that time. So we had a very recently, we had a COVID epidemic and we just saw how it worked. So the history really gives us some kind of, insight how they treated these epidemics, and it actually helps us in developing more and more knowledge and obviously more and more treatment modalities. Next, please.
This one is okay, Prof.
Every ancient civilization, they developed unique medical practices. They were based on philosophy, they were based on religion, on observations. Some practices are still in vogue. If you look at the herbal remedies, which is even being practiced in Ayurveda in India this time, they are the ones which have been actually practiced thousands and thousands of years earlier. So similarly, hygiene, which was the hallmark of the Jewish, Hebrew civilization. And if you look at the hygiene was their hallmark, and it helps even today how to develop hygienic models for treating the communicable diseases. Next, please. Prehistoric people, they usually believed that pain and disease, they originated outside the body, not from the injuries, but from the evil spirits. While doctors and shamans, they were employed to exorcise malevolent beings, but if they failed, there was an operation that might do the trick. Trepanation, one of the very few prehistoric medical practices for which we have archaeological evidence. It involved boring a small hole. That is probably orthopedician will understand. They would make a hole in the skull to treat headaches, to treat some forms of mental illnesses, and it was employed around the world. And we have nice, archaeological evidence in Neolithic Gaul, Bohemia, North Africa, Asia, New Zealand, and South America about this, boring a hole in the skull to treat medical illnesses. Next, please. Egyptian medicine is one of the medicines which is called as pharaohic medicine, because after pharaohic medicine you have a Jewish medicine which is usually referred to as Hebrew medicine. Egyptian medicine is referring usually to the pharaohic medicine. That is the medicine which was medical practices which were adopted during the pharaoh's period. when they settled near the Nile Valley, they believed that diseases came from evil spirits and entered the body through mouth, nose, and ears, and devoured the victim's vital substances. To combat these spirits, a magician uttered spells over the afflicted person and applied ritual remedies. In case of burns, they swapped the wound with the milk of the mother of a baby boy. If you look at this now, the mother's milk, it contains a huge amount of immunoglobulin A, which normally nowadays we ask even at this present contemporary times, medical science, it encourages the breastfeeding for the kids. A reason is because we want them to have a secretory immunoglobulin A, which is present in the breast milk, and that would cover the gut of the newborn or the neonate for a longer time, so that it doesn't get the diarrheal diseases. So therefore, if you look at the Egyptian medicine, they would pour the breast milk. Of course, now that there are a lot of religious practices, they would only when the boy was born out of the mother, so they would use that breast milk. But it has no difference between, at this point of time, we don't find any difference between the breast milk of a mother who delivers a baby boy or a baby girl. So these are the practices which were, adopted by the Egyptian civilization. Next, please. I'm actually going through very, very fast because I'm actually trying to bring you to the contemporary medicine, which is very important, because I have a strong belief that we should talk about the civilizational medicine and civilizational things and all that, but we should not go through there's a Persian saying, a person was begging on the road, but he would say that Pidram Sultan Bud, my father was the king. So therefore, we should actually bank upon civilizations for the development of knowledge bank, not to boost about the civilizations. That is what actually most of the Muslim societies in the contemporary world are saying, that we have a wonderful past, but we don't have a good future. We don't have a good present. So therefore, we should definitely learn from the civilizations, but we should sit in the contemporary science and contemporary technology. There is where I want to say some things about what's happening in the contemporary science and contemporary medicine. Next, please. Okay. If you settle the same, I would go to the previous slide. The magicians would find a connection between various treatments and course of the diseases. Sihr is being referred many a times in Quran. When Moses came onto this earth as a prophet, so he was also being referred to most of the people of that contemporary time, saying that you are a sahir. That means you are a magician. So magicians had a very strong role in treating the diseases. Next, please. Similarly, in Egyptian, that is the Pharaohic civilization, we had the goddess Sekhmet's priest. They would go and and it is all documented. It is even present. I'm told it is present in most of the thing in the London Library. They would call it as papyrus. Papyrus is the scroll which has all the documentation about the medical technologies or medical practices which were adopted by the Egyptians or the Pharaohic civilization. Next, please. Then we come the Hebrew, the Old Testament medicine, which is called as the Hebraic civilizational medicine, and it actually goes before 8th to 3rd before Christ. They believe disease resulted from displeasing the gods, that only priests could help and they could cure. Not so. You will realize that in most of the civilizations, religion had a lot of intervention in medicine, in governance, in the governance of the people also. But even medicine was being practiced by the priests only, and they would believe it would be only the priests who could, treat the diseases. So although there were midwives and circumcisions were going on, because circumcision is also being practiced in the Jewish population, and circumcision they were carried out. That means there were some kind of surgical interventions going on, because circumcision is a surgical intervention. So therefore, they excelled in the areas of the public health. If you look at their whole strength of medical practice, the Hebrew Bible was based on hygiene, and they would wash hands multiple times. They had practices that after burying a dead, how you can take care of your hygiene after burying it. So the hygiene was their hallmark, and I still believe, as a person who has a lot of experience in the present day medicine, if we adopt good hygienic practices, most of the communicable diseases will be treated by a simple adopting good hygienic practices. So this is from the Hebrew region, the Hebrew civilization, that is called. They have given us the hygiene. The priests, they acted as primitive medical officers of health and were keen to prevent the transmission of disease from one person to another. So this was their hallmark. Next, please. Then I touch a little bit about Chinese and Indian medicines. These systems, the two systems of medicine developed in ancient China and ancient India, they survive today virtually unchanged. As I said, that Chinese medicine, like acupuncture, is still being promoted even in the West. I have spent almost half a decade in Germany, and if you look there, they have a lot of acupuncture clinics even now. They are being practiced. So it's a Chinese practice. It was a Chinese medicine, a Chinese civilizational medical practice. Similarly, India uses the herbal medicines, and which are this time in contemporary world being used as alternative medicines, or they are not medicines in a way, but they are being called as food additives, similar to the practices that they have been doing maybe thousands of years before. They differ greatly from those of the ancient cultures, which can be seen as steps way to modern Western medicine. So Chinese as well as Indian medicine, they've also contributed. Similarly, when I come to Islamic civilizational contribution of Islamic civilizational medicine, you will see that these three civilizations have contributed to the modern medicine more than anything else. Next, please. If you look at the Chinese, which is documented around 400 years before Christ, it is contained in their one book, which is called as Ni Qing, which is something called as Manual of Physics. Although it is a manual of physics, but it is all medicine which has been collated into this book. And it was organized in a state system. It is the first thing that state started, looking after the health of the people. So Chinese are the first civilization which started, institutionalizing healthcare in a state system. And they graded them according to the achievements. Lowest were the surgeons. I'm sorry to say that in that Chinese system, surgeons were considered to be the lowest in the cadre as compared to physicians. And although this time surgeons are, in the contemporary times, the surgeons are on the top of the ladder, earning more and doing wonderful things. And in fact, I believe most of the advancement that has happened in the present times is because of the surgical interventions. It's less because of the medical interventions than of the surgical intervention. So, but in Chinese system, surgeons were considered to be the lowest in the grade of achievement in medical sciences. Next, please. I'm actually rushing through. I'm sorry, because it will not. Otherwise, I want to come through the present day, what we have achieved, through the modern, which has got no connection with the civilization. I mean, of course, they are being contributed by different countries, and it has got nothing to do with a particular group of people which would call this time as a civilization. So those are very I would say groundbreaking achievements that we have had in the past 100 years, what we have achieved. So therefore I want to go there quickly to rush through these slides. So Chinese, I would say it deals mostly exclusive with acupuncture, treating disease by allowing energy to enter or leave the body by insertion of fine needles. Human dissection was strictly forbidden in ancient China, and physicians knew very little about anatomy, but some seem to follow known paths of referred pain, such as gallstone pain in the right shoulder bladder, and it describes several pulses. So therefore they knew where to actually strike these acupuncture needles, because those were the areas that they had identified in the body that they are very sensitive to those punctures, and therefore that defined those nerve endings, which in the present times we call them as nerve endings, and they would strike those nerve endings. Next, please. Indian medicine, it is impossible to date the origin of the Indian system of medicine, now known as Ayurveda. The four Vedas, which are the Vedas, sacred Sanskrit books that were passed down orally through ages, are all that is left. So it is nothing documented. If you look at the Indian civilizational medicine, it's not documented, but it's an oral history, but which is as good. I mean, it's considered to be as reliable as the documented one. And Ayurvedic medicine is based on two treatises, that is Charaka Samhita, which is looking after mostly medical, and the Sushrita Samhita, which is the surgical compendium of the Indian system of medicine. No one knows when they were written down, but researchers have claimed that Sushrita could have lived any time between 1,000 years before Christ and 1,000 post Christ. So therefore it's not a very documented like the Chinese documentation, like the Mesopotamian documentation, or even the Greek documentation, which are available. Those documents are available in the museums. But Indian, these two books, they are based on oral historical facts. Next, please. Indian physicians, they also believe that disturbances in the level of various substances like wind, bile, phlegm, and blood were responsible to diseases. The Indian excelled in surgery. That is an evidence which they have developed 121 different steel instruments, which include scalpels, probes, trocars, catheters, and even magnets to remove metal objects to carry out a multiplicity of procedures. Cauterizing fistula, sieving up wounds, draining fluids, treating cataracts, removing bladder and kidney sources, and most remarkable of all, repairing noses and earlobes. That's why present-day Indian surgeons, they believe that plastic surgery was actually in vogue in Indian system of medicine much earlier than today. So therefore they believe, yes, there are a lot of evidences, which again, as I said, these are based on oral histories, that they would repair the nose, and they would also repair the earlobes of the patients. Next, please. Then comes the ancient Greece, which is the Greek civilizational medicine. We have a huge impact of the Hippocratic oath, which probably all of us, all the doctors have to recite before becoming the doctors, because Hippocrates was with the rise of the Greek civilization, physical ills were no longer blamed on the gods or the sins. So it came out of the during the Greek civilization, it came out of those superstitious ideas to the fundamentals, which are based on kind of what we call the evidences. And they were not now blamed on gods or sins, but on imbalances within the body itself. They had a very strong theory of what we call the four humors. They were basis of much medical practices. Even Indian system also talks about the 4 humors. So probably there could have been a mutual exchange between the Indian civilizational medicine and the Greek civilizational medicine, because they are also talking about the 4 humors. Like Chinese and Indians, Greeks believed the balance. Indeed, whole of their civilization could be seen as a search for symmetry. When the balance between the 4 humors was disturbed, the result was the disease. So next, please. The Greeks believed in the existence of 4 fluids or humors within the body, and the balance of which was vital for health. Humors corresponding to 4 elements and the same qualities, and they were also associated with particular parts of the body. Like they called 4 humors as blood, which would come from the liver, yellow bile, which would come from gallbladder, and black bile, which would come from spleen, and phlegm from the brain and the lungs. And whenever something would happen with these 4 sources, that is the liver, gallbladder, spleen, brain or lungs, a disease would come out. In fact, it's not untrue even today. I mean, most of the diseases do come from such kind of imbalances. Of course, we would say nowadays genetics. A lot of genetics has to do. We have a present day concept which we call the epigenetics. Next, please. Greek medicine, it marked a significant shift towards the rational thinking. Why Greek medicine is being referred this time. There came a rationality. Firstly, it actually excluded the sins and the gods from the evidence of the disease. So therefore, it was a major shift. Hippocrates, who is this time also known as father of medicine, he introduced the concept that disease had natural causes rather than supernatural origins. The Hippocratic Oath established ethical principles that continue to guide medical practitioners and medical practices even today. Next, please. Then comes the temple medicine. Of course, it was still, the clergy was still trying to hold the Greek medicine under their thumb. So the Greek doctors recognized the spiritual side also of the healing. When all else failed, they sent their patients to attend one of the many Asclepiadia, which is considered to be their place of God, and they to the patron god of physicians. And this Asclepios was considered to be a kind of a god which was being worshipped by the Greeks. So they would take them to the temple when all the medical system or medical knowledge would fail. So they would go to this temple where they would worship, and these priests would try to cure it. So again, I would put, that's my personal observation, that since the clergy has been very important in the factor of a human being, whether it's the clergy of Hebrews, whether it's the clergy even pre-Abrahamic religions. So even that time, clergy wanted to control the medicine, which is very important, in the human culture. Next, please. Of course, Hippocrates. Hippocrates was a great physician, surgeon. He performed minor procedures as hemorrhoids, even as old as 400 BC. He would actually operate for hemorrhoids and polyps. He has removed many polyps, which is all documented. And he became the leader of a medical school. His works and those of his followers are contained in the great book, which are 70 volumes, which are called as Hippocratic Corpus. They are present in all kinds of museums this time. They range from detailed case histories to thoughts of the practices of the medicine, role of environment in health, epilepsy, and prognosis. This was the major breakthrough from the other civilizational medicine, Hippocratic medicine. That is, they even could predict now the prognosis. What is a prognosis? What will be the outcome of a disease? If any person would be afflicted by a disease, and how he will behave after a particular treatment, which is very important nowadays in present day practices. The prognosis is important. I mean, whenever we go to a doctor, we ask for a treatment. He does a treatment, but we always say, what will be the outcome? What is my prognosis? How do I feel after this treatment? So Hippocrates gave a first time a concept in the medical history that there can be a prognosis which can be calculated by a particular treatment. So that was the greatest achievement in this era. Next, please. Roman medicine, it built upon the Greek knowledge and emphasized public health, sanitation, and military medicine. The construction of aqueducts, sewage system, and public baths significantly improved the population health, which was the, again, hallmark of the Roman medicine. Next, please. Islamic civilization. Now coming to Islamic civilization, which has been a huge, I would say, the contemporary medicine that is existing for the last 100 or 150 years, has all the footprints of the Islamic civilizational medicine. It transformed global medicine between 8th and the 15th century. Scholars, they synthesized all kinds of medical knowledges, whether it was Greco-Roman, it was Persian knowledge that laid the foundation of the present-day healthcare system. Next, please. Now, if you look at the key contributions and scientific milestones from Islamic Gold Age, I'll go through very few, although there are innumerable instances. Next, please. First thing that they gave, it was the first time that we got a hospital-based, treatment. Hospitals were created by Islamic civilizational medicine. Islamic world established the first teaching hospitals, and now they started to pass on the knowledge from generation to generation. These facilities included like separate wards for distinct illnesses. It is the first thing. And see, it's being practiced even now. Now we have a gastroenterology ward, we have a neurology ward, we have a neurosurgery ward, we have an orthopedics ward. Now we have definitely hospitals for different specialties, but it is the Islamic scholars, Islamic medical scholars who gave the concept of different distinct illnesses have different kinds of wards now. And even pharmacies were created by the Islamic physicians. They were open to all patients regardless of wealth, and that came the concept of wealth. If you look at the zakat, has contributed hugely to the development of the medical knowledge, because zakat was available, that money was available, resources were available, capital was available for gaining knowledge and for propagating the knowledge through these teaching hospitals. Next, please. They were called as Maristans, because this was a Persian scholar who gave it, so he gave it probably a Persian name. And if you look at the father of the surgery, who is this time is also being called as, is the Al-Zawari. He is the father of this revolutionary surgery. His 20-volume medical encyclopedia, that is Kitab al-Tasrif, introduced techniques such as cauterization and invented instruments like scalpels, bone saws, forceps, plaster casts. He pioneered the use of catgut. Catgut is being used even today, and catgut was used by Al-Zawari, and he was the first to mark incision on a patient's skin. You see, look, the cauterization, these things are not easy things to think about 1,000 years earlier or around 800, 900 years earlier. They could do it, and this is the innovation which Islamic physicians have actually contributed to the present day medicine. Next, please. We have Avicenna, and he's being called as the father of medicine. Persian, he was a polymath. Ibn Sina, which is being referred in the Western countries as Avicenna, but it is Ibn Sina. He created an encyclopedia that still serves in most of the European countries as the medical textbook in European as well as Islamic universities, where the history is being taught, history of medicine is being taught. It codified the diagnosis and treatment of diseases. It codified the pharmacology. That's why I said that another major contribution by Islamic medicine is the creation of pharmacies. So pharmacology was introduced. How drugs what will be the effect of a particular drug on a particular disease, and the contagious nature of certain infections is also in the compendium created by the Avicenna or Ibn Sina. Next, please. Al-Razi, he was the first to accurately distinguish between smallpox and measles, because most of the times whenever they would appear on a human body, they would look alike. If you look at the measles and smallpox, initially they look same, but the smallpox is a totally different disease and measles is a totally different disease. And it was Al-Razi who had created the distinctive features for the two diseases, and he distinguished between smallpox and pioneered use of controlled clinical trials and chemical substances in these medicines. Next, please. Pharmacy profession, as I said, Islamic civilization elevated pharmacy to a distinct scientific discipline. Pharmacists, they developed sophisticated methods for distillation, extraction, and creating syrups. You know, that is also in Tib Nibwi, we actually have a lot of syrups used for different kinds of diseases, and ointments, and they set up the first professional apothecaries, these pharmacies. Next, please. Ibn al-Nafis, a 13th century physician, was the first to correctly describe the pulmonary circulation, the way blood travels from heart to lungs and back, centuries before the Western anatomists did it. So, next, please. Of course, I would now come to Renaissance and the birth of the modern medicine. It marked a revival of modern Renaissance period, marked a revival of scientific inquiry and anatomical studies. Andreas, he revolutionized anatomy through detailed human dissections, correcting many earlier misconceptions, because he was the first who started, opening up the dead bodies and doing a lot of dissections on corpses to come to various anatomical features of different organs. He corrected many misconceptions, and advances in surgery, pathology, and pharmacology emerged during this era. And the invention of printing press, it allowed the medical knowledge to spread widely, accelerating the scientific progress. Next, please. Modern medicine, it developed rapidly during 19th and 20th century with the discovery of microorganisms, anesthesia, antibiotics, and vaccines. Figures such as Louis Pasteur and Robert Koch, they established the germ theory, transforming disease prevention and treatment. Technological innovations such as medical imaging, laboratory diagnostics, and minimally invasive surgery have further enhanced the patient care. Evidence-based medicine now serves as the foundation of clinical decision-making. Next, please. Now I will go through which were the major, I would say, milestones in the modern medicine that we are actually getting the benefit of today. Vaccines were first conceived in 1796 by Edward Jenner, when he himself used inoculating this smallpox virus into the people who were already infected the smallpox. And he could find out in a primary, it is almost 18th century, and look at the end of the 18th century, he had a concept that there is something that the body evokes an immune response. And if I would actually put smallpox into the body of a person infected with smallpox, he or she will develop some kind of immunity against the same infection. So that was a primary concept. And vaccines this time, you might have seen, even if at all we are surviving today out of the COVID disease, this time it is also because of the vaccine that was developed, especially the microRNA vaccine, which has been used last time. Next, please. Anesthesia is another, major breakthrough in the modern medicine. Before the use of the general anesthetics in the mid-19th century, surgery was undertaken as a last resort, not because there were not good competent surgeons or there were not concept of surgery that we could do, but because of the pain that they would be enduring through the surgical procedure, because there was no anesthesia. So there were countless earlier experiments with anesthetic dating as far back to 4000 BC, but Morton made history in 1846 when he used ether as the first anesthesia before surgery. Soon after, then it was changed to chloroform, and of course they had their issues, ether as well as chloroform. Now we have a wide range of anesthesias, at least nobody leaves or nobody moans of pain in the surgical theater or after moving out of the surgical theater. So we have a painless operations nowadays going. It is all because of these people who have contributed to the development of anesthesias. Next. Germ theory, very important. I mean, as we said that most of the communicable diseases were considered to be diseases because of the sin or because of the displeasure of the God. But germ theory was coined in 1861, and it was said that the disease was caused by spontaneous generation. In words, physicians of the time thought disease could appear of thin air rather than being airborne or transferred via skin-to-skin contact. And French microbiologist, that is the Pasteur, he proved through a simple experiment that infectious disease was a result of invasion of a specific microscopic organism known as pathogen into the living host. So it was the first time that we could think that the communicable diseases that are infectious diseases are caused by germs. Next, please. Then we had a huge impact of medical imaging, which came, although X-ray came in 1895, the rest of the other technologies like CT scan, MRI, now the PET CT scan, they've come in the 20th century. But in the late 19th century, X-ray was one of the, it was discovered by Röntgen, who was a physicist, and it was an accidental finding by him. And that's why we still have the X-rays being, being measured in terms of the Röntgen as a unit. So it was accidentally invented by the physicist Röntgen. Ultrasound was invented in 1955. In 67, CT scanner was created, which uses X-ray with computers, and it became this time the fundamental diagnostic tool in modern medicine. And then Lauterbur in 1973, he first showed the MRI, that is the magnetic resonance imaging, can be used for developing diagnostic tools for diagnosing diseases. Next, please. Insulin in 1921, discovered by Banting and Best. It was the greatest breakthrough because, there are two types of diabetes. We have diabetes 1 and diabetes 2. Diabetes 1 is considered to be, it comes through the childhood. It comes through which we call the juvenile diabetes, and they don't have the insulin of their own, and they would simply die by the birth year of 4 or 5 or 6. They would die because we did not have anything to offer to them. And when in 1921 insulin was discovered by these two great scientists, diabetes 1 was considered to be a fatal disease. It turned into a manageable chronic condition. And this time we were using the porcine insulin till very recently, till hardly 30 years before, 25 years before. Now we use human insulin. Otherwise, we were using the insulin from the pork pancreas. And now we have the human insulin, which is being manufactured in the laboratory through genetic engineering. Next, please. Antibiotics. It was the greatest of the great, invention by Paul Fleming. It was an accidental finding that he discovered the penicillin. And penicillin was discovered early in 1928, but till it was not becoming very popular till World War II. World War II, many for the militaries were getting eradicated completely. I mean, the European military was getting infected by the infections, and they would die. So, but this penicillin, which was first discovered by Fleming, but it was mass produced by an American guy sitting in London, and it saved most of the militaries, most of the armies from infections, and they could win the wars because of this one antibiotic. Of course, we developed then the resistance to penicillin. We have this time large number of antibiotics. We have come up to the 5th generation antibiotics. Some have developed resistance, some are still working, and we will have continuously more and more antibiotics in the basket to offer to the infections. Next, please. The double helix DNA structure. It's one of the major achievements in present day medicine. Reason is Watson and Crick, they discovered that the DNA is double helical. They actually defined the structure of the DNA. If they would have not done it, we could not have the immunotherapies and the gene therapies at this point of time, because we this time can easily dissect out a particular gene segment because we know what is the structure of the DNA. So these two, Watson and Crick, they discovered the DNA. And Professor Rafi Abadi, I created in their name a Center for Molecular Medicine in University of Science and Technology, Islamic University of Science and Technology. We have a big center of Watson Crick Center for Molecular Medicine in Islamic University of Science and Technology. This time they have a funding of, only 2 days earlier, I met the chief of that, whom through while I was the Vice-Chancellor and he became the chief, Dr. Muzaffar Macha. He told me there were 56 crore grant this time. I mean, that's a huge money in Indian context. And they're actually working on most of the, non-communicable diseases in that center, working for the treatment modalities on cancers as well as diabetes. And these are, in their name, we created the center here of molecular medicine. Next, please. 1954, we had the first organ transplant. Most of the people would die of the kidney diseases, and the first transplant that was done was through a kidney. And this time also, we have a shortage of kidneys, but I will come to the stem cell, another discovery, which is in the next few slides. And the organs are deficient in presently available for organ transplants for the patients, but the kidney transplant has become almost a routine surgical procedure in most of the countries now. Although there are also scandals in third world countries associated with the kidney transplants, but it's a major discovery, and people can survive normally after a kidney transplant when they are transplanted a kidney from a different donor because their kidneys have failed. So it was during 1954 that the first transplant was done of the kidney, but this time we have the heart transplant, and now even the brain transplant is being tried to success, but there are still some limitations on that. But hearts have been transplanted and they are working so well. So we have sometimes, heart and as well as the lung transplant together, in a patient, which are doing only at very few centers in the world. But this transplantation technology has become a very major breakthrough in the contemporary medicine. Next, please. Polio vaccine. If any one of us knows in the neighborhood that how polio affects the young kids when they're infected by polio virus, and how they get crippled and how they get disabled through their life. And the polio vaccine, which was first discovered by John Salk, he developed, and this time even now we have. Most of the times we refer to smallpox as completely eradicated the infectious disease. Polio is also very close to near eradication. Of course, there are some countries still which are reporting a case or two of the polio vaccine, but it's a major breakthrough which has been achieved by vaccinating against the polio virus, which was discovered by John Salk in 1955. Next, please. Antiviral drugs, we most of the times did not have the antiviral drugs. And if you look at the HIV disease, or we commonly refer to AIDS, AIDS was almost a death warrant. If we would give an AIDS positive certificate to any person, it was a death certificate to him. He would never live for more than 2 to 3 years, because from the infection, from the infection date to AIDS, where he would get a full-blown AIDS and he would die of opportunistic infection, it would be hardly 3 to 5 years or 6 years maximum. But because of these antiviral drugs, this time which is being given to these HIV people, it's almost controllable. It's not completely eradicated. Of course, it is completely eradicated in what we call the vertical transmission from mother to child. When the child is being groomed in the womb of a mother, we have completely knocked out the HIV infection in the newborn because of the stoppage of the vertical transmission. But in case of the adult HIV infected people, we have controlled HIV disease by the use of the antivirals. And these were first discovered in 1960s. Next, please.
Sorry, sir. Just keeping in view the time constraints.
Okay, I will conclude. I'll conclude. I'll conclude with the last slide. If you go to the last but one slide. Okay, just a stem cell therapy is one which is actually taking care of the shortage of the organs in future.
This one, sorry, to interrupt.
Pardon me?
This this slide or next, this one?
Okay, you can leave it. I'm just going to say about a couple of things about stem cell technology. Stem cell technology is the technology which has been recently, in hardly 1990s, it was found that the cord blood, that is the blood which comes between the mother and the child, we have a lot of stem cells which can be groomed, which can be trained to develop into brain, to develop into kidneys, to develop into different kinds of organs, because they were not trained at that stage. So if we can give them signals and train them for a particular organogenesis, for particular organs, we may be able to develop different organs in the laboratory scale and then transplant them into the human bodies. That is also going to be a very huge contribution to the modern science. The last but not the least, where I have worked myself, is the gene therapy. Gene therapy, I have personally worked, and I have a patent in that area, where I have actually given how I can treat HIV positive people with my gene, which I have designed in the laboratory, and then putting them into the hematopoietic stem cells, into their bone marrow cells, and how they develop into the immunocompetent cells which are not infected by HIV. So these are some of the technologies which we are using this time, and which are in practice, and which have a huge impact on our good health. I mean, if you look at the immunotherapy which is being practiced nowadays as one of the one of the good technologies or medical practices, is how cancers are being treated by using of the antibodies against the cancers. And those antibodies, though this time are very expensive, of course there are a lot of other issues. Many doctors and even I say there are a lot of mafias attached to these therapies, but they have given respite to most of the cancer patients. So yesterday I read this. Japan has developed a blood test that detects 13 types of cancers from a single drop of blood. You can well imagine, just one drop of blood, it will detect 13 types of cancers. And when we develop these types of diagnostic modalities, the outcome is very good. I mean, when you develop diagnostic modalities at the earliest stage of the carcinogenesis or cancer building up or cancer development, you will see the outcome is really good, and the treatment costs are much lower. And so it's a huge step forward. Only National Cancer Center of Japan, in partnership with the Kyoto University and the Toray Industries, they have developed this liquid biopsy blood model, which will have huge impact on the human health. And now coming to 2 points in the end, where I will conclude, is we should bank upon these civilizational knowledge. It is very important, and it also helps us to develop newer technologies and newer modalities of treatment. But it is important to be a part of the modern technologies. What we have seen, most of the third world countries, including India, even if they are, they're claiming that they are in the center of the technologies in AI, we don't find most of the third world countries are somewhere very close to what the first world is already in. Like we have robotic technologies being used in medical practices. We have artificial intelligence being used in this. So like most of the civilizational impact is to be considered, but we have to be a part of the present day technological advancements so that the benefit goes to accessible benefit goes to our populations. What is happening is because of the IPR, intellectual property rights, the access to these modern technologies becomes limited for first 5 years of the innovation. So these people, they bleed the poor countries or poor patients through nose by using their technologies because they're protected under IPR. So therefore, what is important is whether it is Islamic countries, whether it is even India, but China is far ahead in most of the technologies nowadays. But India or Islamic countries which are boasting of their past, they should actually sit in the contemporary world and should try to use the modern technologies for the benefit of their patients, so that these IPR does not actually give inaccessible reach to our own patient. So therefore, I stop here only, and I thank all the panelists here to have listened to me and given me a chance to talk to such a galaxy of intellectuals, and hopefully I've been able to do justice with a huge topic which was given to me by Professor Rafi Abadi, and it's not my competence to do justice, but I have been actually able to collate a little bit to bring it before you. Thank you very much.
Thank you so much once again, Sir Professor Mushtaq Siddiqi, for your insightful and very comprehensive, I should say, the presentation, very informative, and so many areas we have really explained, emphasized in a very detailed manner. So before going to the next segment, I would like to invite our chair of the session, Dr. Haizen Muhammad Yusuf, for the reflections of this session, to hear some reflections of this program. And later, with his permission, if the time permits us, so I request our chair of the session and host, so that if we are allowed to extend the session for a few more minutes, so that we can entertain the question and answer session in a detailed way and a comfortable way, I mean. So I would like to invite now Dr. Haizen for reflections.
Okay. Assalamu alaikum. Thank you, Prof. Siddiqi, for the amazing talk. I felt that listening to your talk, I'm taking a journey on a flying carpet through ancient times towards modern times, through many civilizations, from herb treatment to basic hygienes to gene therapy and stem cells. Amazing talk. Thank you, Prof. Now, we in this modern era, especially for the Gen Z and for us now, communication between each civilization is very fast. It's very rapid, very mass. How do we handle it? And how do we differentiate between true science and pseudoscience? And I felt that in your talk, in your last part, you have pointed out something significant to me. With all our advancement in medicine, which we are still progressing, the true measure is not only the technology itself, but how many people you can benefit. How is it accessible to the people? That is the system that we can look into. In the civilization, we have looked into the Muslim Wakaf system, the Burma-Eastern hospitals. We have looked into the Chinese state-sponsored hospitals, how we reach the people. In the place I practice, we are the best hospital in the world, well, one of the best hospitals in the world, a journey of 25 years. But we can see that the best technology seems to benefit those with the financial means. And this is something that we as thinkers have to, and thinkers have to steer from our learning from the civilization to ensure that it does not benefit the selected few.
Extension.
Yes. So that's my words. I think we don't have much time, but thank you, Prof. Siddiqi, for the excellent talk. Thank you very much.
My pleasure. My pleasure.
Thank you so much once again, Dr. Hazen Yusuf, for the comments and reflections or the detailed presentation given by Professor Siddiqi. So, by your permission, are we allowed to extend the session for 10 more minutes for question and answer session for the participants? Is it okay, sir?
Yeah, it's okay for me.
Okay, thank you so much.
I think if it's okay for Chairman.
For the, is it okay, Dr. Hazen? Are we okay to extend our session for 10 minutes for question and answer session?
Sure, no
Thank
problem.
you. Though it's late in Malaysia, it's 11:15 p.m. So thank you so much, sir, for your generosity. And thank you so much, dear participants, for listening very patiently and enthusiasm. So without wasting any time, I would like to request our participants, if they have any question, they may directly ask it to Professor Mushtaq Siddiqi. You're welcome, my dear participants, if you have any question. We have the raised hand from Brother Antonio. Yes, Antonio Segura. Okay, you are welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor.
Alaikum assalam.
First, I wrote it in the chat because I wasn't sure if I was able to ask you, but I wanted to say Jazakumullahu khairan kathiran for this interview and for this session we had today. It was very informative. I think I will start with my second question, as I have two bit longer questions, as you can see. But I think this one may be a little more relevant to what you spoke about and also me personally. Currently, I'm here studying in Malaysia, but my home country is the United States of America, which is a country that factually spends more on healthcare than almost any country in the world, yet continues to struggle with chronic disease, mental health crises, and declining trust in medical institutions, as we saw with the COVID-19 epidemic. So from a civilizational perspective, does this suggest that medical advancement alone is insufficient without an underlying ethical or philosophical framework? Essentially, to clarify, I'm asking if medicine and civilization develop together as conjoined twins that you said, can a civilization be considered medically advanced if it possesses cutting-edge technology, but struggles with social trust, mental well-being, or equitable access to the care, which you kind of alluded to in the ending? Jazakallah khair.
So let me first talk about actually United States or countries like United States. The problem is the discriminate access to healthcare. I mean, if you look at the healthcare is not accessible to all equally. So you have a Medicare there. The Medicare is not available to all of them. So therefore, as Professor Hazen also talked about, which I also talked about, is we have a lot of medical technologies or medical interventions available this time for treating most of the diseases, but it is the access to those technologies which is actually an issue, or which is a limitation. So that is why I emphasize in my own talks and wherever I have worked, even in universities where I have talked to my own faculty, the access to a particular technology is very important. It's not important that there's a technology. Whether it's a medical technology or it's a scientific technology, otherwise like physics, chemistry, or other technology. So since the IPR has come into the existence in the world, IPR means the intellectual property rights, and these IPRs, they restrict the use of technologies by countries like ours. So therefore, first is what we call the access to these technologies. Second issue, what you are raising is these technologies are good sometimes, but they have also impacted on our mental health. And I do not find much when I browsed through these AI tools, I browsed through civilizational medicine, I did not find much being talked about the mental health issues in those civilizations. It is, but it's not. It was not a major issue. But this time, what we are seeing this time in the contemporary world, we have a lot of mental health issues, and probably that is because of the technologies that have come, which are overlapping technologies with medical technologies. Like, for example, a screen. I mean, a mobile phone. Although it gave us a lot of advantages of communication, but it has brought in the young minds into the focus, whether we should give them that access to this screen up to the age of 16. That's why you are seeing that many countries are actually groping with legislations, bringing in legislations not to give access to children below 16 years. So what is actually happening is there are mental health issues that are coming into the focus more than the other organic diseases, which are like infectious diseases, which we call as communicable diseases or non-communicable diseases. So therefore, two things should be very important. One is access to these technologies. Everybody should have an access, irrespective of the financial status of that individual, of that patient. And second is that we should also look at the mental health issues which are bringing into focus the use of these technologies, especially the communication technologies.
Dr. Irfan has some question, I think.
Assalamu alaikum wa rahmatullahi wa barakatuh. My question may not be directly related to science or the innovations in medical science, but what concerns me most is that how can Muslim community meaningfully revive its historical legacy of excellence in science and technology, which we all together praise that in the past we had heroes who contributed a lot, but now a big gap persists. It actually makes me restless sometimes that we are being labeled as doing nothing in the field of science and technology. So what steps should we as Ummah take to improve our strategies in terms of education, in terms of intellectual, I can say, upbringing and such things?
See, I would react to, I'm as much restless as you are. I mean, most of us are as much restless as you are. I mean, about I'm not only thinking in terms of the people of Muslim faith. Actually, I'm also thinking about, because the people of my faith or Islamic faith, they are also coming to, they belong to a very poor socioeconomic class also, most of the Muslims. So we shouldn't look at the Dubai, or we shouldn't look at Riyadh or Jeddah or Kuwait, which are big cities. But if you look at the Muslim societies, they are very poor. So access to healthcare is very important. So that bothers me, that bothers Dr. Irfan or Dr. Rafi Abadi equally. What has happened, this is my opinion, what has happened in the past, and which should be the responsible point for what we have been actually restless about. We lost touch with gaining knowledge. Knowledge is very important. We thought that probably the knowledge is only to go to Darul Ulooms and become Hafizes. And actually, if we look at, so we ignored some of the teachings of Prophet Muhammad Sallallahu Alaihi Wasallam. That is, if you have to gain knowledge and if you have to go to China, don't desist from it. And China was not a Muslim country. It was not even having an Abrahamic faith. I mean, it was not having faiths from any of the Abrahamic, descendants. So therefore, that means he wanted his followers to go to China to gain knowledge. What was the knowledge in China that time? When I look at, I'm a little bit, looking at mathematical mathematical equation or mathematical scoring of different prophetic periods. When I see the Chinese period in Prophet Prophet's period has been very good, glamorous in medicine. So probably he wanted his followers to gain more knowledge of medicine going to China. And in India, we had mathematics that time in that era, which was flourishing in India, what was called as Al-Hind. So therefore, we lost touch with the knowledge. We should go back to the knowledge, and this sense of inquisitiveness, asking question, has been barred in Islamic societies for the last 500, 600 years. We are not being asked, we are being, discouraged to ask questions, because when we ask questions, there is a fatwa, it is un-Islamic. So therefore, we should actually start asking questions, not on faith. We should ask questions on knowledge. We should first acquire knowledge and ask questions. When you ask questions, you actually innovate. Innovation comes from asking a question. When you actually stop asking a question, you can never innovate. So if we have to go back to our civilizational roots, if you look at those Al-Zawahiri's, Ibn Sina's period, they were having knowledge, grip on knowledge. So they would actually control the knowledge of that time. They would translate the knowledge of Greek, the knowledge of pharaohs, knowledge of Hebrew into Arabic, which was considered to be the Islamic language that time, because Quran was in Arabic language. So therefore, my suggestion is that we should start becoming, our centers should become center of gaining knowledge, epicenters of knowledge. And once we have knowledge, and the knowledge should not be restricted only to faith. Knowledge should be overboard to other fields, physics. Quantum physics is, how many Muslim scholars are in quantum physics this time? Hardly any. These are what we call the jumping technologies, where you can get huge advantages in understanding of the cosmology and other things. So therefore, I think my answer to your question is, we should go back to the gaining of knowledge, and our universities should become centers of knowledge rather than only of centers of faith.
Thank you very much. Even though it's a very philosophical and debatable issue, we are supposed to reconstruct and reinterpret our narratives. Because you see, the moment you develop a sort of critical thinking in you, it somehow does not feel compatible with the faith which we are being taught. So sometimes it becomes a very hard nut to crack, and say that we should adopt critical learning, critical thinking or reaning does not become so easy.
So it is important to study how they, Al-Zawahiri's, Ibn Sina's, actually, how they made a balance between these two things, what you are saying and what I'm saying. You see, critical
Islam
thinking, they also might have gone through this. Yeah, sorry, sir, please go ahead. Please.
Actually, what I have felt is that Islam taught them that the nature which you see is a created thing, and you can go and do research in it, which was not possible in the polytheistic era. So Islam created a way of inquiry and new search, but later on the theology which we were taught actually shut the doors of reasoning and critical thinking.
True.
Thank you very much. Thank you very much.
Thank you so much.
Assalamu alaikum.
MashaAllah. Yeah.
Brother Umar Shabo.
Yeah.
Dr. Shah, right?
Yes, Prof.
So,
Can I
Prof,
Please,
Prof,
you can ask.
okay to entertain one more question?
Yeah, exactly. I have a question.
Okay.
Go ahead, Umar.
Okay. Thank you so much for the wonderful presentation, and it is indeed useful and insight. We really learn a lot of information about medicine. So, Prof, actually what I just really want to ask, even though I understand that you are not talking about this civilizational dialogue from the religious perspective. So you just mentioned that from the Islamic perspective, if someone called Sahir, meaning that a magician, And also you said they played a significant role in medicine. But looking at what we learned along from the historical perspectives, we understand that this magician, to some extent, sometimes they are misleading people when it comes to medicine. To some extent, they instead of to give them the right thing that they're supposed to apply or use, they can just go beyond the limit to the extent it become a negative to their health. So in this, I just want to understand, Prof, which kind of role they really played from the historical perspective.
If you go through my presentation, and also Dr. Farid, if you could share my presentation with all the participants later when we complete it.
Yes,
what
sure.
I said was the Pharaohic civilization, which is considered to be pre-Moses civilization. They were actually practicing the medicine through the magics. Or magicians and all that, but it has no scientific basis at this point of time. I mean, I think I would say that it has been discarded immediately after, by Romans also. They have discarded this. Roman medicine has also discarded the role of magicians in treating the diseases. So therefore, present day has absolutely no space for the role of magic in treating the diseases. So I would take it as a superstition.
Exactly. Thank you so much, Prof. I really appreciate this answer. Jazakumullahu khairan. Barakallahu fikum.
Once again, so keeping in view of the time constraints, so if any participant is having any question, they may email us so that we may forward that to our keynote speaker, Professor Siddiqi Saab, inshallah later. So when we have the direct communication and answer about your questions. So at this, now I would like to invite Professor Hamidullah Malazi Saab for the vote of thanks and for the closing of the session. Thank you so much once again, Professor Mushtaq Siddiqi, our chair of the session, Dr. Haizen Yusuf, and all the dear participants for this session. Professor Hamidullah Malazi, you're welcome.
Jazakallah, mashallah, we were enlightened by the detailed presentation of Professor Mushtaq Ahmad Siddiqi, and he has just taken us to different type of civilizations and their contribution. And all the civilizations have contributed a great deal to development of medicine. And in this way, we can learn from the doctors and medical men how to become a Siddiqi.